You're listening to the Business Spotlight Podcast, a production of the Lancaster-Fairfield County Chamber of Commerce. I'm Logan Weaver, the marketing coordinator for the Chamber. Thanks for tuning in. Today, I have Kristin Glasure, the president and CEO of FAIRHOPE Hospice and Palliative Care. How's it going, Kristin?
It's great. Hey, Logan. Good to see you.
Good to see you. I know this is a busy time of year for FAIRHOPE, especially with a lot of events and a lot of celebrations going on here lately. No pun intended, as we'll discuss later. But as we begin to dive in, let's talk a little bit about what FAIRHOPE Hospice is and what you guys do.
Okay, thanks for having me today. This is kind of exciting. You're doing a great job.
Thank you.
Yeah. Well, FAIRHOPE is your hometown hospice. You know, we have been, and we're going to talk a little bit about that, we have been in this community for 40 years. And this year we are celebrating that all year. 40 years ago, we started with just a few volunteers in the area that really wanted to work and provide special, compassionate end-of-life care to people in our community. And so I guess for a couple of years, they started that with using some volunteers and some nurses from Fairfield Visiting Nurses. And when that happened, the hospice movement became very big. And they started to think, you know, this is such an important work. It's catching on. Maybe we need to try to make this really into something, and we can, you know, talk to Medicare and try to get reimbursed for this so we can provide more care to the families in the community. And that's exactly what they did. So in 1984, we received our Medicare licensure so we could reimburse for all the care that we were providing. Started very small. We were one of the 4th hospices in Ohio to get that certification, which is great.
Oh, wow. So as you mentioned, 40 years, which is a huge milestone for any business, especially here on a local level. So kind of tell us about what you guys are doing this year to kind of celebrate that milestone.
Yeah, sure. So we decided, we just decided that we were going to celebrate all year. Something that we say a lot is celebrate life. And that's what we want to do. So we started at the ribbon cutting that the Chamber was so wonderful to help us with. And we celebrated actually the 40-year anniversary. And so then we have our big event coming up in March 21st. And the theme, we always pick a different theme each year. And the theme that we've chosen this year is just really 40 years. And so we're going to celebrate that with a lot of great history, a lot of guests, just try to raise some money. That's our key fundraiser. All the money that we raise goes right back to taking care of our patients.
Tell me a little bit about some of the behind the scenes, how that works as far as, you guys do the fundraising, you get the proceeds. How do you guys help the patients and their families during these difficult times? Because obviously when people think of hospice, they may think of, doom and gloom, those types of things. But obviously, with you and your team having worked with you guys, it couldn't be anything but the opposite.
Oh, thank you. Thank you for that. I think one thing, first of all, we have the best staff. I mean, really, people that come to work for us, they come because they're called to do it. We've either touched their lives in some way. They feel really called to just come and give back. And so that makes for really good caregiving of our patients. And the one thing that we strive to do every day, and I tell that staff, you know what, you have one chance to do this right. I mean, we have one chance to make the families feel comfortable, to support them, take care of the patients. So the care that we provide is really end-of-life care. We want it to be compassionate. We want to be dignified and just provide that comfort. There's a lot of studies that show that when someone decides to sign on to hospice, their life expectancy actually increases. Oftentimes, like you said, people think, oh my gosh, I'm going to sign on to hospice. That's just, the end is near. But
yeah, some see it as like a death sentence
already.
I
know. But you know what? The way we look at this is this. This person who comes to our service, they have a terminal illness that if that disease follows its normal course, will take their lives in 6 months. Now, with that being said, there are many patients that we have on service for a lot longer than that. And we have a lot of patients that come to us just a little bit too late where we can only help them for, a couple of hours, a couple of weeks, or a couple of days. But the care that we're providing them, and those studies show that it gives them quality of life. So when people are comfortable and all of their needs are met, that increases their life expectancy. Even if it's just a couple of weeks, that's very important.
And I think from the hospice side of things, especially with your staff, one thing that is beneficial in helping these patients and their families is helping fulfill their final wishes, because sometimes, in life you're not able to, get to certain things, and especially when they're in that situation where they know their time is coming, whether it's a couple weeks out or 6 months, as you mentioned, having a staff that's so caring and so able and willing to help these patients meet their final wishes, I think is very important as well.
It really is important. And, I think a lot of what we do, we listen. It's very important for those first couple meetings that we have with the families is just listen. What's important to them? And that's always a question that, before I did this CEO job, I was a social worker. I still am a social worker, but my role was a social worker. So one of the questions that we always ask, and I know the nurses do, is what's most important to you? And you'd be surprised at those answers that you get. I mean, it can be anywhere from being right here, sitting on my couch with my family. It can be, I don't want to be at home when I pass because I don't want my family to go through that. I mean, it can be a lot of things. I just want to enjoy this time. I want to get out and, take a car ride. I want to go on one last vacation trip. And so we always ask the families and the patients what's most important to them. And those are the things that we focus on. That's the care that we focus, so that the end goal will give them what they need.
As a nonprofit, and especially being so ingrained in the community, how does FAIRHOPE stand out from other hospice services?
Well, that I could talk about that all day. But, I think a couple of things that are really important, and I say this often, is all hospices have the same regulations. Like, we all have to follow the same rules, but we do those pretty differently. And some of the things that you'll see that we do is we kind of stay the course. I'll tell them, we're going to provide really good nursing care. We're going to be there for them 24/7. So the family has a crisis or an issue at night, they're going to make a phone call. They're going to get a person who will answer that call and come out and see them. The other thing that I can't talk enough about are just our great aides that come into the homes, we service in the facilities too. So the aides will go to the homes, help the families just with a nice bath. Maybe they'll sit with the patient while that caregiver gets a shower. Maybe they haven't been able to shower or sleep or take a nap. We have, the other thing too, is we have almost 100 volunteers. And that is, that's way above and beyond what others do. And the things that we do with those volunteers, they do everything from coming to the facility and sitting at the Pickering House from 8 a.m. till 8 p.m. They'll sit with our patients who don't have families. They will fill the bird feeders at the Pickering House. They'll sit with families at home. We do a lot of military pinnings to honor our patients. The other thing that stands out is just our grief support. Like I said earlier, the regulations say that you have to provide 13 months of grief support to the survivors. A lot of facilities, a lot of hospices will do that, but maybe it's a phone call, maybe it's a card. We stay in tune and communicating with those families for at least 13 months. Sometimes after that, we have grief groups at the Anita M. Turner Center on our campus. And then we service all the schools, which I think is really just a hidden gem. And you don't have to be on hospice to receive the bereavement care or the services in the school, which is, that's amazing.
Yeah, I know friends and family who have utilized those services who didn't have a family member in hospice, but they were still able to utilize those services, and especially going into the schools. I think that is very interesting because especially this day and age where, mental health is so important, having that available to all ages, regardless of what they're going through, background, or anything like that, I think is a crucial resource. And especially as a nonprofit, being able to offer that, I think is, very commendable that you guys are able to offer that.
Thank you. We're really proud of that. And, a couple pieces to that would be that, like Lancaster City Schools, we work with Pickerington, Fairfield Union, all the Logan Hawking schools, and they're so supportive. Like, they are so good with their children and their students. They will call us and send a referral and say, hey, you know what? I think this student's going through this. Would you be willing to see them and to talk to them? There's no charge for any of that. No charge for any of those services in the school, not for any of the bereavement care, which it has to be a huge burden lifted off of some of those families and teachers.
And I think a lot of folks may see that, from other services, other providers, seeing that as a potential hurdle. And, going back to how you guys continually offer those services, having that face-to-face connection, I think, is very important as well. Because, you can offer a phone call, offer a card, and things like that. And, it's easy to get back I'm fine, or, those types of
Yep,
real
for
quick
sure.
responses. And, on the other side of that, it's easy to give those responses, but having someone or an organization like FAIRHOPE on the other side who's willing to meet face to face, because you can say I'm fine, but if you just see the person,
You got it.
you know that they're struggling.
That's exactly right. And you build those relationships. So when you do sit across the table from someone and you want to talk about your grief, you feel a lot more comfortable and less vulnerable. And I think that's one of the most important things that we do. You know what I think, too, to mention is in this community and in the schools that we see, we service a lot of children whose families have gone through drug overdoses, homicides, suicides. I mean, I think sometimes we don't think that those things are here in our community, but they are. And so I am so grateful that our team can support those children that are going through those really tragic things.
Absolutely. That's a very crucial, vital resource to have. Mm-hmm. And as I mentioned, in this day and age where mental health is so important, it is so important to get it right that, having those services available at no cost too.
Right.
You got to wonder why more people don't take advantage of it too. So I think that's great to be able to be present at the very least, even if people think they don't need the services. Just being present and always being there as an option, I think will help, get people through the doors as well, and, be able to offer those services to more and more people.
Yeah. And it's easy. All you have to do is call one number. Just call the number. Can I say it?
Yeah,
the number?
Go ahead.
740-654-7077. If you call that number and just tell them what you need. I need grief support. I want to be a volunteer. I want to donate to the event. Whatever that looks like, just make that call.
I know from working with a lot of nonprofits, we've seen it through our Faithful Leadership program, where the volunteer or the nonprofits that we work with, volunteering is one of their biggest priorities. From your standpoint as a CEO of an organization that, as you mentioned, is heavily reliant on volunteers, how important is it to have them, and especially in the quantity that you do?
So I think the bottom line, when you talk about the business end of it, Medicare requires us to provide 5% of all the care that we give to our patients. 5% of that has to be provided by the volunteers.
Interesting. Did not know that.
Yeah. So a lot of people don't realize that. But when you look at it, and we look at that every month because we want to make sure that we're meeting all of our regulatory, compliances, we provide anywhere between 15 to 18% of all the hours that we spend with patients. 15 to 18% are volunteers. That's pretty incredible. Wow. So you have to think about it this way. It sounds like we have a lot of volunteers, 100 volunteers, but 20 of them can only work in the evening. 20 of them can be on the weekends. Some of them only want to come and sit with patients overnight. Some want to do more activities and events and things. So we have a perfect mix of volunteers, and we can never have too many. We have, we service 7 counties. I would love to have volunteers in all of those counties.
Yeah, that would be great.
Yeah.
So tell me a little bit about what you guys do for the community as well, because it's more than just the hospice services or the grief counseling, because you guys also have some pretty major events throughout the year as well.
We do. Our biggest, so I think everyone knows about the Trash to Treasure event, that first weekend in June at the fairgrounds.
Never know what you're going to find.
Oh my gosh. I remember seeing, you and a lot of people out there and just looking at all the things. And I can't explain it if you haven't been there. So what happens is, and that is completely volunteer driven, those volunteers will set up 2 to 3 barns full of donated items from people in the community. They'll come in, drop them off, we set them up, and we sell that. And everything that we sell, every penny that we sell is donated back to us from the volunteers. And that is huge. That's a big service. I mean, that's a lot of money that they provide so that we can, maybe provide something special for something that we would need at the Pickering House or to take care of our patients. So that's a huge event, and it's very fun. A lot of good bargains, but I think the biggest thing that we do throughout the year is our fundraiser is the one that's coming up in March. And so that is going to be at the Mill Event Center this year. It's on a Thursday from 5:30 till 8:30. But the great part is we're going to do some online bidding for a lot of items.
Nice.
You can purchase a ticket to get in that night, or you can just, sign up to watch the bidding items, watch all the items, bid on them. But all that money that comes back from that event will go right back to taking care of our patients.
That's awesome.
Yeah.
Great to hear that. How can people get tickets for the Celebrate Life event in March?
Great, good. There is a QR code on our website page, so fairhopehospice.org. You can click there. There's a big picture that says our event. Click on that. You can order tickets through there, sign in. You can call the number that I gave you previously. You can stop in. We'll get you tickets. We're still accepting sponsorships, donations of auction items. So, yeah, we're getting excited. The countdown is on.
If there's anyone who is seeking hospice care for their loved ones, or if they are looking to volunteer or just want to learn more about FAIRHOPE Hospice, how can they do so?
Sure. So I think the first thing is just remember that one number, and that's 740-654-7077. Our website is fairhopehospice.org. If you're on Facebook, Instagram, you can go there, follow our page. We have a lot of information, just tips about how to work through things. Every event that we do, every opportunity to volunteer, you can call, you can get on Facebook and reach out. That's the first step. The other thing I would say is that if you've had a conversation with your doctor and the doctor says, I think it's time for hospice, you don't have to be an expert. All you have to do is make that one phone call and say, listen, this is what my doctor said, I need help. We'll take it from there. We want it to be easy for you. That first phone call is always the hardest. And so if we can alleviate and take that from you, we'll do all the other work.
Well, Kristin Glasure is CEO and president of FAIRHOPE Hospice and Palliative Care. Thank you so much for coming in and talking on the podcast today.
Thanks, Logan.
You've been listening to the Business Spotlight podcast presented by the Lancaster-Fairfield County Chamber of Commerce.